Reports show the need for mental health services have increased throughout the pandemic. Cone Health's new behavioral health center is setting the bar for care around our state. It's the first urgent care in the state to offer both long-term behavioral and mental health services. This in-house option offers holistic treatment for physical and mental needs. Since opening in the summer of 2021, the facility says it's seen a great need for its services.
So we have been able to keep up with demand, and we are hiring more psychiatrists. We've seen 8,000 visits in our urgent care. Those volumes we did not expect. Same with outpatient services. Our volumes are high.
In addition to mental health, substance abuse cases are also handled at the facility. Medical Director Dr. Archana Kumar says a lack of housing is one of the biggest issues she's seen among several patients.
If I have a mental health crisis, whether it's addiction, and I don't have a place to live, I don't have the social supports, prescribing a medication is not going to solve it. You're going to need all those social aspects to make that person successful. And that can only happen when a community comes together.
As the facility continues to grow, clinical nurse Sean Taylor says the center will continue to work with community partners to better address mental health in Guilford County.
For the long term, how do they continue to get those medications? How do they continue to get housing? How do they continue to get the benefits that they need? And I think a lot of times that's a matter of having that old case manager who used to hand off and kind of go with them.
Guilford County's Behavioral Health Center is open 24/7 and serves both adults and children. I think that this is such a great resource and that there's something unique like this addressing the mental needs of others in our community. Specifically if somebody's having a mental health crisis and they go to an emergency department, they're going to be waiting for hours because somebody with a physical need is going to be seen first. Yep. So the fact that they can get somewhere, get the help that they need, get on a plan, I think it's a great thing.
I mean, how many times do we have to say it that mental health is so important? And, I mean, arguably as important as your physical health, if not more. Mental health can lead to bad physical health if you don't get that taken care of first.
And what a big shift in perspective to start thinking this as a community-wide issue, right? The fact that you got to have housing. If you don't have housing, you might have some mental issues. You can't get your prescriptions. It really is a way of thinking that's brand new.
It puts it in a perspective as to why everyone should care about it. And I really liked how she broke that down because I think that's an angle a lot of people don't necessarily think about. So as they continue to grow and move forward, they really want to work with community partners to address, food insecurity, housing, getting people insurance, because if you're trying to sign somebody up for some type of health insurance and they have a chronic mental illness or something that's severe, they're not going to understand how to fill out that paperwork. So having case managers in place, that's going to really help with that.
And by the way, city leaders say those are some of the same things we need to do to tackle crime and other big issues in our community too.
This is the start of a lot of things.
Yeah, be exciting to see what they do next.